Today, I want to talk about long-term lithium use, its risks, and what that's meant for me, and the things I'm doing right now to mitigate it. And this whole video is very sudden. I've had a tiring day at work, but I'm gonna try to get through it and get this information, you guys, because I think it's really important. And it's important because it comes as a response to a lot of people who comment and tell me on any video where I say I take lithium that my kidneys are gonna fail, my thyroid's gonna fail, my liver's gonna fail, and I'm just gonna pass away early because I take this medication. And all these comments, they show up where on videos where I'm like saying how psych meds have helped me, how psych meds are helpful, how they are a net positive to society, and these comments, they demonize them almost. It's almost like these people want people to not take lithium at all because of the risks of long-term side effects, which means that not everyone will get them because they're side effects, right? And so, there's people. And this shows up on like YouTube long-form videos, short-form videos, Instagram, TikTok, Facebook, everywhere I get comments like this. And so it's kind of funny because I actually recently decided to do something about it, just to kind of get the knowledge out there. And so I was talking to a friend, and the friend kind of urged me to go get tested now for kidney function test, for example, because lithium is known to cause issues in the kidneys long-term. So it has long-term side effects of causing thyroid issues, that type of thing. And so this friend kind of urged me to go get tested, and so I went and got tested. And I also did this after asking other people in my life whether I should get tested, and they agreed that I should get tested. And so I went to my NP last time I saw him, and I said, hey, I'd like to get my kidney level tested and other stuff that lithium might be causing because I want to mitigate any long-term side effects if I have them. Like, I'd love to catch them before they're a problem. And he's like, okay, sure. So I took a blood test, and it was pretty chill. Just take a few vials of blood. I don't know how many they took, but it wasn't like, it was a kidney test, but I didn't have to like pee in a cup or anything. So that was kind of nice. And so sent off the blood, tried not to stress too much about it. It was fine. But I mean, my main worry with it is I come from being on lithium for less than a decade, but over 5 years. I've been on lithium since college in an effort to treat my mood disorder. So like, it was treating my bipolar disorder back then, and now it treats my schizoaffective disorder now. And it's actually my favorite medication that I take for a wide variety of reasons. I mean, I have many videos on my channel talking about lithium, going to a lithium spring, talking about the history of lithium. Like, I'm a fan of lithium, and I think it's really awesome, which is why it kind of makes me upset so much when I see people say bad things about it in the comment section. But everyone's allowed to say what they want in the comment section, so it's fine. But anyway, I got my blood test, and I just waited. I waited and I waited and I waited. And I got my test results back today, actually, which is again why I'm making this video very suddenly, because I wanted to make it while I was still really thinking about it. And I'm really happy to say that my kidney function tests came back great. They came back normal. So my kidney function is great, which I'm very happy about. And my thyroid was also checked, and my thyroid function came back as well. I don't have any signs of hypothyroidism, which is good. So as of right now, lithium is not causing me any long-term effects that I have to worry about. And that's such a great, wonderful freedom to not have to worry anymore, because I was worried there when I got the blood test and can get in the results and stuff. And so, yeah, but he also tested other things, because there's other stuff that my doctor runs, like metabolic tests and whatnot. So like, for example, I guess it's because I take an antipsychotic, which causes metabolic syndrome in some people. So that's a risk factor cluster for people to develop hypertension, diabetes, and other stuff. And it's just not good. And it's a side effect of antipsychotic use. And so as part of the usual panel that my psychiatrist, don't have a psychiatrist anymore. I have a nurse practitioner kit. Be good about it. My NP also tested my A1C, which came out to be a little bit low. And the A1C is like a 3-month measure of like your blood sugar levels kind of thing, something like that. Not exactly sure exactly what it is, so don't quote me on that. But I do know that it meant that I had lower blood sugar over a long period of time. He mentioned that it might be a sign of like chronic hypoglycemia, but he didn't really say for me to do anything about it. But I thought that was interesting because I take a I take an antipsychotic, I take Zyprexa, which you'd think would cause the A1C to go the other direction, because the other direction, the higher it is, the closer you are to diabetes, and higher A1Cs can be really, really dangerous, really, really fast. And so it's kind of interesting that it's too low. So I guess I'm just gonna go eat some baked potatoes and have a soda or two, probably something like that. But this whole video is not to say, I'm not saying that. Some people might say the fact that I had to ask for this test at all was proof that my NP did not actually care about me enough to test it. Like, every doctor should be testing for these things. And here's the thing, I'm not a doctor, I'm not an NP, so I don't know what the doctor or the NP's thought process is when asking for necessary medical tests when it comes to this stuff. I would have preferred if the whole time my kidneys have been tested. Would have been nice to know, but it wasn't. I won't know why, I don't know why, and I really don't care why, because it's getting done now and that's what matters. But I'm glad that I was in an environment where I could go to my NP and say, hey, can you test my lithium, can you test my, not lithium, test my kidney levels, my kidney function, and test my thyroid levels and stuff. And he was able to do that. So if you're in a boat where you're like on lithium long term, you've been on it for a while and you haven't gotten these tests done, it's just a simple blood test. Talk to your doctor, talk to your NP about it. It gives you so much peace of mind to know that, like, everything's okay, and I in the future will get these tests done again to hopefully continually be okay. That way I can keep taking lithium for a very, very long time and have its effects continue to be positive in my life, because I've seen a lot of positive things in my life happen since I started lithium treatment, which is why I'd be so sad if I had to go off of it, because I did have any kind of, if I did have any kind of kidney issue. This is why it's so important to stay on top of your health, because if you do all the testing and you make sure you stay on top of things, you'll catch things early if they happen. So if I do end up with kidney issues long-term or thyroid issues long-term because of lithium, I will know about it because I'm being tested for it so regularly. And when it comes to mental illnesses, chronic illnesses, like all this stuff, if you stay on top of your health, things are going to be a lot easier in the long run. It might be a lot of work, but like I don't want my kidneys to like just go away without me realizing it. So I will continue to get my arm, you know, pricked to get the blood taken so that I can keep getting the tests. And I think it's really important to send that message to people to please, 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 please stay on top of your health. If you have any thoughts about anything I've said in this video, feel free to drop them below in the comments. And if any of you are going to warn me about the long-term effects of lithium, joke's on you, I already know. But other than that, thanks so much for joining me and making the uncomfortable comfortable. Subscribe if you haven't already, and I'll see you in the next one.